Hi, I'm James Gardner, certified athletic therapist, certified strength and conditioning specialist. I'm going to do a tape job with our friend here, Ross, for his AC joint. The acromioclavicular joint is the joining of the clavicle on the front side and the point of the shoulder blade as it comes up and over the front side. This joint is typically injured in sport by taking a blow from the outside, and the joint itself is injured. The ligaments may be injured inside. But common symptoms in day-to-day, sleeping overhead for prolonged periods, painting, doing anything that's up overhead in the day-to-day can also cause some discomfort at this joint. This joint generally feels pain when reaching across the body or reaching up to the sky or to do something down and behind yourself. So these are typical injuries that may cause pain here. This is an area that definitely requires medical attention if it has continual pain, just like anywhere else in the body. So please seek medical attention with persistent pain. So for the AC joint tape job, we're going to use two pre-cut pieces of tape. We're going to have blue and pink because mobility tape comes in multiple colors. This will just show the definition between, or the contrast between the two pieces of tape. So pre-cut, and I've just splayed this in the middle because the tension for this tape is actually going to go over the joint itself. This is a small joint, so there's a small showing of the elasticity. I'm going to take essentially all of the elasticity here and place it down on the joint. So what we're doing here is creating a compressive load over the AC joint, allowing the tissue to approximate between the two bones where the ligaments are. So I apply that pressure downward there, and again, if this is an active AC joint sprain, pressing on that bony joint, or where those two bones intersect, is going to be extremely painful. So I'm avoiding pressing on the bony prominence, pressing around it, and then I'm essentially just peeling the tape down, allowing it to stick as I've already created the tension over the joint itself. On the front side, I'll try to avoid any chest hair or anything like that, but I'll come over here and lay it down. The second piece of tape will essentially just create an X, and again, that tension is going to be through the middle of the tape and right over that same spot. Again, if this has been diagnosed and doesn't require any further attention, the analgesic effect of this tape will be beneficial right at the joint itself. So I'm going to take that tension on the tape, hold the tension on the tape, and display it right over top of the joint. Laying the tape down over the front side, I can follow the contours of the body. This doesn't have to be specific to anybody other than the person that the tape is being applied to. So a nice round shoulder, I can just follow the contours of the body. On the back side, I don't really have to worry too much about any landmark other than laying the tape down and ensuring it sticks. Back up and over, we've created an X. AC joint tape job. This can be applied by yourself, but again, with any persistent pain, be sure to check in with a medical practitioner. They'll rotate Ross to the front here and have you check in. So again, the tension is applied directly over the joint. This AC joint is made up of the acromion, which is the hook of the shoulder blade coming over the front side, and the clavicle, which is the collarbone here, little ligamentous space in between the joint that has some give to it. The pressure allows those two bones to come together and can aid in the healing of any damage to that AC joint.